Elimination. The renal system. First we have a picture of the kidney with the adrenal gland on top. Next we have a picture of the kidney and its circulation. Remember that the renal artery goes in and the renal vein comes out. So what do the kidneys do? First off, they filter blood. They regulate blood volume and blood pressure. They activate vitamin D. And they have a role in the production of red blood cells. Let's talk about filtration. That has to do with waste removal. And through it we maintain fluid and electrolyte balance. Also, they maintain acid and base balance. They do this by conserving bicarbonate. That means they reabsorb it back into the body. And they secrete hydrogen ions, which means they eliminate it in the urine. The kidneys help with blood volume and pressure regulation. The adrenal gland secretes aldosterone. Sodium is reabsorbed from the nephron, and guess what? Water follows. Blood volume increases, and therefore blood pressure increases. The kidneys also secrete renin. Renin functions to convert angiotensin into angiotensin II, which causes vasoconstriction, and again, the blood pressure is going to increase. Kidneys work with vitamin D to activate it. And now the vitamin D aids in the absorption of calcium from the intestines. And the kidneys also function to produce erythropoietin. This substance stimulates the bone marrow to produce red blood cells. So, if the kidneys fail, we'll have an increase in the metabolic wastes left in the circulation. We'll have fluid and electrolyte imbalances. We'll have decreased activation of vitamin D and decreased erythropoietin. What we're going to end up with is hypertension, heart failure, and edema because of the fluid and electrolyte imbalances. We may also end up with acidosis. Skin disorders, GI disorders, neurologic disorders, and sexual dysfunction also occur in renal failure, and that's because of the waste products building up in the blood. Because of the lack of erythropoietin, we'll get anemia, and because vitamin D is not being stimulated, we'll get a decrease in calcium absorption. We'll end up with hypocalcemia and osteoporosis. The daily volume of urine that is eliminated is between 700 and 2,000 milliliters a day. Urine is typically clear and yellow. It contains urea, which is the end product of protein metabolism, specifically the catabolism of protein. It is produced in the kidneys, stored in the bladder, and excreted from the body through the urethra. Alright, here is a picture of the nephron and glomerulus. The nephron is the functional unit of the kidney. Blood flows and filtrate, and urine is produced by going through the pathway of the glomerulus to the proximal tubule, to the loop of Henle, through the distal tubule to the collecting duct, the ureter, and onto the bladder and out of the body. From here you can see the kidney receives a whole lot of blood fresh from the heart. In fact, 20 to 25% of the cardiac output goes to the kidneys. The kidneys receive a full liter of blood every minute, and they need that blood not only to filter it and get rid of the waste products, but also to feed the tissues of the kidney to keep it going. Urinary filtrate. We have secretion, which means stuff is coming from the circulation into the filtrate. We're pulling fluids, we're pulling different waste products out of the circulation and going into the filtrate, and the filtrate is eventually going to become the urine. But also during this time, we have stuff moving from the filtrate back into circulation. That's reabsorption. Depends on what the body needs. Does the body need a little more salt right now? The sodium can be reabsorbed back into the body. Does the body need some more fluid? The fluid can be reabsorbed from the filtrate back into the circulation to get to the body. And eventually the filtrate is excreted as urine. The transport of urine goes from the ureters into the bladder via peristalsis. So it needs that activity. It's not just gravity. It needs that peristaltic movement as well to function efficiently. The bladder fills, which activates stretch receptors. That will then signal the contraction of the detrusor skeletal muscle, which is around the bladder. And that happens via the parasympathetic fibers. And then there has to be the relaxation of the internal and external urethra, which will result in micturition or urination. The contraction of the detrusor muscle and the relaxation of the internal sphincter are both involuntary activities stimulated by the stretching of the bladder. The bladder stretches, sends a message to the brain, parasympathetic impulses say, okay, let's go ahead and urinate. That's the contraction of the detrusor muscle and the relaxation of the internal sphincter. However, it's not always convenient to go to the bathroom right then. What happens is the body gets the message, the consciousness gets the message, I gotta go to the bathroom. Then it is the voluntary relaxation of the external sphincter that actually allows the elimination of urine to occur.